It's just that she reported that she went for 48 hours without sleep?
I don't remember that time quoted. I know she had difficulty sleeping.
You indicated in your testimony that, and I quote, I would have preferred to have more information about her sleep patterns, right? Do you remember saying that?
Following the changes in the medications that we were making.
So sleep pattern would be just what it says, sleep pattern, like you sleep from 9 at night till 7 in the morning or
Yes.
12 at night, whatever your pattern would be, right?
Yes.
And why is a sleep pattern important for you as a psychiatrist trying to evaluate your patient?
Because difficulty sleeping is a symptom of several different conditions, and it can worsen several different conditions.
And you know that she had reported severe anxiety, right?
She was struggling with anxiety, yes.
Struggling with anxiety, and she was having not just insomnia, but she had very, very severe insomnia, didn't she?
She wasn't able to sleep.
And you would prefer to have more information about sleep patterns, is what you said. I'm not putting words in your mouth. That's what you said.
I know that we were able to observe her sleep while she was on the unit. Once she left the unit, I would not know how she was sleeping, which is why we referred her to somebody else so that they could continue to monitor her symptoms.
Obviously. So let's put the time that you are observing her, or that your social workers are investigating to whatever extent they did, her background. What were her sleep patterns that were important to you prior to New Year's 2023?
The amount of sleep is important.
Yeah, and you said that. You already said, I would have preferred to have more information about her sleep patterns.
After she was if I was going to continue to evaluate her, I would want to observe her sleep is what I meant.
Oh, so you didn't mean that as an evaluator of her prior medical history, trying to get a history of your patient for purposes of diagnosis and treatment, that you wanted to know what her sleep patterns were. You didn't mean that you meant prior?
The history of whether somebody is struggling with insomnia is important, and the patient can relay that to me.
Okay. You ever heard of patients that minimize their symptoms and lie about their symptoms sometimes?
Yes.
Okay. So it's important to corroborate what the person is telling you, right? I mean, you want to talk to somebody else objective to find out what, if any, evidence there is of symptomology.
And we did that with Patrick.
I'm sorry?
So when a patient presents and they're talking to us, it is not just about what they are saying. It's about their body language, their eye contact. You can get a sense of whether a person is being honest or whether they're lying. And we are not, we're providers. The patient is there to get help. They're going to tell us what is bothering them and what they're concerned about. That's why they're in the hospital.
This woman was in a locked ward. She couldn't walk off your unit, could she?
That is what a psychiatric unit is.
Right. And she was very sick, wasn't she?
I don't know what you mean by very sick.
Really? You indicated that you would assume that she would take what I prescribed. Do you do that with all of your patients? Assume that when they have mental disease or a defect that they would do what they're told?
If they are cooperative, and they have been cooperative and reliable, yes.
One of the things that's referenced would be, she stated that she had intrusive thoughts. Remember that?
Yes.
What were the intrusive thoughts?
From what's stated in the medical record, thoughts of suicide.
Okay. how often would she have the intrusive thoughts?
I don't recall if the frequency.
Would you agree with me that in addition to anxiety and in addition to inability to sleep, that she was in what was self-described as a brain fog, right?
She complained of feeling, you can complain of feeling foggy.
She also complained about that she felt as if she was a zombie, right?
She did not use those words.
Anybody else use that word describing her in your investigation?
No.
Did Patrick tell you that he was concerned about the medications that she had been prescribed over the past 2 or 3 months?
Yes.
And you knew what the medications were that she was prescribed, correct?
She told us.
She told you, okay. And she told you that she was prescribed, in addition to the SSRI Zoloft, that was increased from 25 to 100, that she was then told...
I was aware that...
I'm sorry, 50.
Correct.
She was then told to stop taking the Zoloft by Dr. Tufts, right?
She reported not being able to sleep, and they agreed that she would not take the Zoloft.
Okay, so the answer is yes. She was told to stop taking the Zoloft by Dr. Tufts, right?
I think you would have to ask Dr. Tufts that
Well,
question.
I will. But I'm asking you, as investigating her...
I know that she stopped taking the Zoloft, and that she saw Dr. Tufts, so I assume that they would have come to that agreement.
All right, so as you're evaluating this patient, you're assuming that she voluntarily stopped taking the Zoloft?
Because she wasn't able to sleep, and she discussed it with Dr. Tufts.
She did. You knew that.
She told us she did.
Okay. How many patients have you treated, how many women have you treated that were suffering from postpartum psychosis?
I don't recall. I don't remember, but I think it would stick in my memory, so I don't think that I probably have.
You don't think you probably have?
I don't think I have. I haven't seen any.
How about postpartum depression?
Yes.
And how many patients have you treated with postpartum depression?
Over the last 20 years, there are lots of patients I have seen. Okay. I don't keep a record of what diagnoses and what people I see.